In this episode of the Mental Healness Podcast, Lee Hammock sits down with cognitive psychologist Dr. Sharon Niv to explore the quiet revolution happening in mental health. We talk about breaking through emotional walls, rethinking anxiety and depression, and why ketamine isn't about tripping. It's about showing up more fully to yourself. You'll hear how this therapy is helping people process trauma, build emotional skills, and create a new relationship with their mind.
What is going on, beautiful people? Welcome to another episode of the Mental Healness Podcast, hosted by your favorite diagnosed narcissist, me, Mr. Lee Hammock, better known as Mental Healness Everywhere. Today, we have a very special guest for y'all. We have Dr. Sharon Niv. I almost did it. Dr. Sharon Niv, who is a cognitive psychologist that explores how contemplative and therapeutic methods can reshape mental wellness. Her work expands mindfulness, cognitive science, and the psychology of consciousness with special focus on how altered or expanded states of mind can promote emotional growth and resilience. In 2022, she co-founded Joyous PBC, which is a public benefit company dedicated to making mental health care more affordable, which we definitely need, and accessible through low-dose or psycholytic approaches to ketamine treatment. Welcome, Dr. Niv. How are you doing today?
Hi, Lee. It's good to be with you. How are you doing?
I'm doing very, very good. Like I said, I gave you a little introduction. How about you introduce yourself to the audience and do you more justice than I ever could?
Yeah, that's right. So I am a cognitive psychologist, and that means I think about the processes of the mind, processes of emotions, processes of the body, too. I mean, we are a one collective system, of course. Cannot really separate thoughts, feelings, and sensations. And in 2022, I did co-found this company, Joyous Public Benefits Corporation. Now, what a PBC means is it is a signal to potential shareholders that we put our mission above shareholder value. And our mission in particular is mental wellness, accessible, affordable. And so we do prescribe a protocol of very low-dose ketamine. So people may have heard of higher dosing ketamine, which is, it's a beautiful thing. You can do it with your sublingual, you can do it with intramuscular, or very commonly people go into IV clinics and get it straight into their bloodstream. And the higher dose stuff it's a journey. You're not really a participant. Your psyche is going to go where it wants to go, and you can get things out of it that it wants to get, and that's great. But this is a different animal. I actually have my little pack here. I am a patient as well as the co-founder. And so these are much lower doses. This is what our medicine looks like. It is placed between gum and cheek up here, kind of like tobacco snuff, I guess. But the state that people then achieve, as you use the word psycholytic, that's exactly the right term. It's not a psychedelic, it's a psycholytic state. So the difference there is what psychologists or psychiatrists refer to as being fully oriented. You know who you are, where you are, and what you're doing. So the psycholytic ketamine state is one, because it's a dissociative, that can be described as like spacious. It's almost bigger than your body. All right, you have a sense of who you are, and with this medicine at these doses, you can get to a state where you kind of feel like there's a psychological distance, and it's quite literal. There's a distance between yourself and the sensations of your body, the sensations of your nervous system. And as we've kind of come to understand over the last 10 to 20 years, what negative emotions are, effects of trauma, effects of attachment wounding, they tend to be carried in the nervous system, and they manifest as unpleasant bodily sensations, right? And these are things that we want to avoid feeling. When you feel depressed, it's like a feeling of heaviness and sickness. You feel anxious, it's a different kind of sickness, it's like a unpleasant, buzzy sensation in your body. You just kind of want to escape it. And trauma, of course, whenever it's evoked through the concepts that we associate with our traumas, and we're talking about big traumas or little traumas, like little t traumas, developmental trauma, not being seen by your parents, not being accepted by your grade school community, whatever it is that really hurt you, even though it's not considered big T trauma like abuse, like assault, like war, it still makes a significant impact on your well-being. So what ketamine allows is a spaciousness from these experiences that leads to a couple of different things happening simultaneously. One is that we often understand that in order for a sensation to resolve, like a sensation associated with our traumas, with our psychological angst, it needs to be fully felt. And as we said, there's like a resistance to feeling these extremely unpleasant sensations most of the time. With ketamine and that spaciousness, you can feel them. I had a psychologist that we work with, a LCSW actually, a social worker, a clinical social worker, say it's like a blanket of safety that kind of covers my patients, my clients, as I work with them. And they're able to go there in a way that they can't before. So we do a couple of things at Joyous. One is we just prescribe straight to the patient themselves if they're a good fit. We have the medical monitoring here, the medical verification of any contraindications, psychiatrically, medically, contraindicated medications that there aren't too many, by the way. It plays nicely with a lot of different medications. So you can take it straight as a patient and do your own work. And recently, we also decided to launch this program, Joyous for Therapists, which is a free collaboration program with licensed clinicians who want to understand how to bring this into their own sessions with their patients. And what we've seen is really exciting, really huge breakthroughs in therapy. So that's my overview. I'm sorry, I kind of like railed at you for.
No, I love it. No. I love it. I love it because you asked us some of the questions I was going to ask anyway. I was like, I was just checking stuff out. I was like, there you go. So, I'm glad you just mentioned the part about the Joyous for therapists, like how people can integrate that into their therapy. So I have, I've been in psychotherapy myself for 8 years, dealing with narcissistic personality disorder, and part of what you just said, you have to feel things to actually go through them to deal with the trauma, like little T or big T and whatnot. I used to take shots of liquor before I went into therapy sometimes, because I'd be so anxious and nervous about stuff. I used to take shots, and I was just like, this isn't healthy. I was just like, this is not healthy. I wasn't trying to get drunk. I was just trying to take the edge off so I wouldn't be afraid to feel. Would ketamine be something that can take the edge off in that situation right there to make you more open to the sensations of therapy like that?
100%. So first of all, like I want to name that's like your body's wisdom. It's saying this is too intense, this is too overwhelming. I need to take the edge off. I need to numb this a little bit. That's body's wisdom. Like we respect that. But yeah, absolutely. Just like you said, taking this small dose of ketamine prior to the therapy session can take the edge off in the same way while keeping you present. There's this kind of ironic, paradoxical thing where it's a dissociative. So some people think like, no, you won't be present with a low enough dose. So like with higher doses, yeah, you may have a full ego death. Things can happen and resolve on their own, but then you need to integrate them. With these lower doses, it's exactly that. Like you are still oriented, like we said. You are still, you know who you are, you know where you are, you know where you want to direct your own attentional system. But there's this like nice, spacious, you kind of feel like you're both inside and outside your body. You can drop into a state where it just feels safer. Like instead of whatever anxiety is like taking over the whole system, you're kind of like a big, spacious room. And the anxiety's still there, but like now it's smaller because you're bigger.
Yeah.
And you can work with it more effectively.
So I love hearing it though. That sounds like literally, I think the anxiety comes from a lot of shame with me, right? So I'm stepping to the therapist's office. There's some shameful topics that I'm about to talk about, and my body automatically just wants to get rid of them. So I used to take a shot to just like kind of force myself to go through it because I know that's what I need to do. Because you mentioned being intentional. I need to go in here. I need to talk about this because what's the point? So I feel like if people were to subscribe to what you're offering, like the ketamine stuff, I feel like that could be a big step, a big leap into maybe combating that shame, or just not even making it go away. Of course, like you said, it's still present. The anxiety is still present. It's just smaller. You can probably like, even when I take the shots, I'll still feel it in my chest, but it's just like, I can deal with it as opposed to it just taking over and just shutting me down and just making me steer clear of what I actually wanted to talk about and discuss in therapy session.
That's
and
exactly right. It's a safety aid that helps you go there without feeling like it is taking you over. That's exactly right. Really well said.
Yeah, that's good then, because that's a really good thing right there. Because like I used to take a bunch of shots. I don't do it so much anymore because I know it wasn't healthy, and I know I needed to face what I needed to face. But I can understand that if people were just getting into therapy, or people wanted to take the next step in their therapy journey while they've been in therapy working, I feel like that could be a powerful, powerful aid in their journey right there.
That's exactly right.
But I do, like I said, when I hear ketamine, I actually watch, like I said, I was telling you before I hopped on, I watched your Ignite talk on YouTube. And at the very, I was writing down questions, and at the very end, you showed that the screen capture of Matthew Perry, because I think that's what a lot of people think when they come to ketamine. They're just like, oh, I don't want to take that and be in the hot tub and pass away and whatnot. But you mentioned earlier, it's low dose. It's very low dose and manageable and whatnot.
Yeah, Matthew Perry is such a heartbreaking case. I remember in his autobiography, he writes something like, I was born addicted. I don't remember the substance. I think it might have been opioids that in pregnancy, in utero, he experienced some of that. And he was born addicted. And he says in that book, I know the next time I relapse, it'll kill me. And indeed it did. And that is, I mean, just thinking about that is like, whew. But yeah, on the Matthew Perry front, he was found with what the New York Times described as anesthesia level dosing of ketamine in his bloodstream. That means that someone with, who was naive to ketamine, who didn't have a ketamine addiction, would be out. They'd be out for surgery. It's a huge amount, something like 50 to 100 times a dose that we would prescribe. We would still say, don't take it in the hot tub if you think you're going to get a little bit dissociated. It's not a great idea. It's good to lie down. It's good to sit down. It's good to meditate. It's good to be intentional with watching where your system goes with this medicine. Yeah, regardless, one, he drowned, and two, the amount of ketamine. Plus, it wasn't an opioid, but I believe it was like Suboxone, which is an opioid blocker found in his bloodstream. It's just a different dosing that we're talking about here. It's sort of like taking a whole bottle of Tylenol will wreck your liver, but taking one Tylenol is fine.
Okay, yeah, I was like I said, that's when I was like, ketamine. That's literally because I guess it was so publicized, and he was such a just a powerful figure in media and whatnot, and so popular with Friends and all the other stuff that he's been in, and just his story about how he was battling depression and what you said earlier about how he said he was born addicted, and it's kind of like that path led him down that path, and it didn't. Ketamine wasn't what killed him. I think that's what people like. He actually drowned. But ketamine wasn't what took his life and whatnot. That's where my mind went to when I saw that. But you said 50 to 100 times what y'all would prescribe?
Yeah. To go into from a psycholytic dose to go into surgical dosing is it is a many orders of magnitude higher. Nonetheless, I mean, you bring up a good point, I think, about the potential for addiction. We do know that ketamine addiction is on the rise globally. So it is something that we want to be very conscious of. There's no known addiction risk with these doses that we prescribe. It's sort of like an alcoholic would not become an alcoholic based on one shot a day. But it is something that we're very conscious of. We try to screen out people who have a history of substance use disorder, if they're not very, very stabilized at this moment, because it is still a substance. It is still psychoactive, and anything that helps you feel good can become psychologically addictive. And we don't want this to be a crutch. We want this to be a tool.
Yes.
Right? We don't want people taking low-dose ketamine for the rest of their lives. It's an interesting conversation that we have internally in that, hey, some people need insulin every single day, and some people experience such severe mental health symptoms that they do need more constant support. But our ideal happy path is someone who takes ketamine with us for 3 to 8 months and then feels so much more stabilized and has used the time wisely to skill build that they feel they're able to discontinue the medication, which, by the way, is considerably easier than something like SSRIs. There's no known withdrawal, no like brain zaps, no crashes that come after discontinuing ketamine. And so our happy path is a patient who graduates and just feels better. They got new skills, they got new habits, and they're able to approach their life in like a reforced way.
So that's like the common theme I saw from the reviews on your site, joyous.team, where people, they were graduating from it. They just said I did it for 5 months and now I'm just, my anxiety is gone, or is way lower than what it used to be, which I think most people have anxiety issues or they deal with anxiety in some way, shape, or form. But and I think one guy on your site said that he was actually battling other substance addiction issues in his past, and he was able to just use the ketamine treatments for 5 months or whatnot, maybe 8 months. I can't remember the exact timeline. But he said he was able to get off of that like no problem. He's had addiction issues in the past. I was like, oh, that's because that's one of my questions I wrote down was like, does it have addictive properties? And then when he said, he's like, I have had substance abuse issues, and I was just 5 months and I was gone. I was like, oh, interesting. So it's just, I feel like that's, and you yourself, you said you are you are prescribed to it as well. So it's just like, hey, I can tell you exactly what it's coming from right now. So that's a good thing right there, because
100%.
like you kind of like your own billboard for it right there in that situation.
We call it dog fooding in the tech world, but no, yeah, that's kind of a joke. But yeah, I do actually also have my own prescription. I don't take it daily anymore. One thing that we tell patients when they start out treatment is when you feel as though you have significantly improved your mental health, when you feel better, start spacing it out and see how it goes. And I probably take my doses 2 to 3 times a week, kind of depends on the stress levels, what's going on in my life. But I do find that it's a support during moments where I really feel dysregulated. And it will continue to be a tool in my toolbox as long as I need it, absolutely.
Okay, I love that. I love that. It's like in your toolbox as long as you need it, because you never know when you might need it. What drew you towards like the ketamine and the psycholytic medicine?
So me specifically, I'm a meditator. I really find the question of consciousness fascinating. It's a funny thing, enlightenment is a real thing, and we don't really know about it. It's a really, it's not binary, it's not either or, but it's a set of states and experiences that really can persist over time, where one is not sort of ruled by the egoic narrative in the head anymore. There's a spaciousness, there's an observing stance. And for me, the hope was to bring as many people to the realization of this possibility as possible. And I was like, well, if I can get everyone to meditate 2 hours a day, I would certainly do that. But that's probably unrealistic. What I can do is introduce people to kind of the shallow end of the psychospiritual pool of the experience of what does it feel like to be in a quiet state where the constant running narrative in my mind is not ruling everything that I see and kind of placing lenses on the world that I see people as bad because I have a belief in my head that people are bad, or I see the world is unfair because that's how my childhood shaped my consciousness to experience life. But this low dose state can give you an alternative perspective. It's almost like a North Star to what is possible, to the kind of life experience that you can have. It's available to you. And if you are smart enough about taking the learnings that you have on this low dose state, I'm just going to grab my guy again, and learning what you can from this in order to bring it into your default state, then you are going to find yourself closer and closer to a much more enlightened state, much more awakened state. When we first started ideating on Joyous, we thought, well, maybe we should go the high dose route. It's effective, it's popular, and we're not enemies at all of the higher dose state of ketamine, or higher doses of other psychedelics, psilocybin, iboga, MDMA. Certainly, they all have their places, they all have their functions and their healing capacities, but low-dose ketamine didn't exist as an offering. It didn't exist as an opportunity for people. First of all, it's far more affordable than the higher dose stuff at the moment, unfortunately. Like right now, there are a couple of options for people. If you want to go into IV ketamine treatment, it's like $2,000 for each experience. Not really affordable to people. Certain insurances do cover Spravato, which is Johnson & Johnson came out with a ketamine analog. Well, it's an enantiomer. I don't want to get too technical, but they're like mirror images to the ketamine molecule, and they took one. It's the S versus the R, and they call that Spravato. And so that is available to some people through their insurance, but not everyone. And that's also a higher dose situation. You have to be in clinic. You have to be monitored by a clinician through that entire process. And again, it can be very powerful for people. We are not here to take that down, but this is just a different animal. This is an animal that allows people to skill build. The people that I talk to every week, our patients on our platform, we lead meditations, we lead discussions, just really share with me. They are using this to skill build. It is a tool in their toolbox. They set an intention. They come to insights. They journal afterwards so that they can learn what it is that their inner wisdom has to tell them, what they can take away from that, how they can be the person that they know they want to be. And so this, I didn't set out to do the low-dose ketamine, but when it was revealed to us as an option, an opportunity, and we started to explore it and see its immense power with the patients that we were treating, we were just all in.
That's good. That's amazing right there. So, who would you prescribe it to? 'Cause I was going through the Joyous.team site, and I noticed the anxiety disorder is part of it. And and I not only do I have narcissistic personality disorder, but I also have general anxiety disorder as well, which is kind of where it comes from. And it's just that's very interesting. So, how would it help somebody with an anxiety disorder? I know it's kind of lowers it and whatnot. We had kind of crossed over it earlier, but what would it do for somebody with an anxiety disorder? And
Sure.
first question, I'm sorry. Who would you prescribe it to? And then we'll get to the anxiety disorder. Well, I got ahead of myself.
So right now, our main prescription categories are for depression, anxiety, adjustment disorder, which is like you're dealing with something big and you're a loss of identity. Perhaps you were fired from your dream, whatever, a divorce, something that really riles you. And then the fourth major category is trauma, PTSD. And the way that we find that it works for people, say, with generalized anxiety disorder is, so through that spaciousness that we described, a couple of things happen. One, we already described that the sensations of the nervous system become much more tolerable, and you're able to sort of allow that to be felt, and then it kind of releases and resolves on its own. So a lot of people just kind of feel that this layer of anxiety that they live with all the time kind of lifts. Some people have actually said, this is the first time I realized how much of a layer of anxiety I have is when I felt that it was gone for the first time. And that's just a beautiful thing to hear. The other maybe major mechanism that we might mention is that because of the dissociative piece, but you're not dissociated, we're calling it partially dissociated, you're bigger than your body, you also get a perspective shift. You're able to sort of spontaneously see your own situation a little bit from the outside, get some insights into it, be able to see some of your own behavior, and be able to maybe reassess, how true is this? These beliefs I have that cause me a lot of anxiety, how true is that really? There is one of the leading theories of how psychedelics in general work is called rebus, which is relaxed beliefs under psychedelics. And it has been found that ketamine works in a similar way. So what that means is a human being experiences the world not just through its senses, but first of all, through its belief system. We have ways in which we engage with the world around us. We mentioned a few earlier, the world is bad, people are bad, I can't trust people, no one likes me, or, I have to win. Whatever it is that got kind of lodged into your belief system tends to be the first lens through which we take in the world, and we absorb the evidence that fits that and kind of discard the evidence that doesn't. Now, what ketamine does, as well as other psychedelics under the rebus model, is it relaxes those beliefs enough that you get more input from the bottom up, more input from, hey, what's actually going on right now? Can I reassess this? Can I reevaluate the truth of my beliefs about what's going on? And that process kind of happens spontaneously. Like, we've now treated 83,000 patients. The vast majority of them had not brought it into therapy because our Joyous for Therapists program is pretty new, only a couple of months old. We did some surveying. We found that about 15% of the people who responded to the survey already brought it into their therapy sessions, which is kind of why we founded the program. We were like, well, we might as well teach therapists what to do. So maybe some percentage of our patients are already using it with a skilled clinician as well. But even without a skilled clinician, let's say 85% of people are not using this with a clinician. They're kind of either spontaneously receiving the benefits of these relaxed beliefs and the ability to reassess reality in a way that's, less married to the anxieties that rule our experience. If it's not spontaneous, then they're doing it through journaling, they're doing it through the meditations that we provide. We built a program for nervous system regulation. We're building other ones right now around self-compassion, around understanding parts of yourself and being able to meet them with a self-compassionate stance. I'm sure you've come upon like internal family systems as a framework and how that works. Yeah. So there are various frameworks that we're going to be teaching the patients as we go forward as well, to give them skills and tools that they can use to start rewriting the anxious patterning that happens either spontaneously or deliberately, intentionally. And the more that people give their intentional attention to the process, the more they're able to maybe journal just for 30 seconds. What did I learn during this 40-minute period with a medicine? That helps bring that learning out into your default life. What we don't want is people getting stuck in state-dependent memory, which like, well, I'm wonderful when I'm on my ketamine for 45 minutes a day, and then I forget everything else. But to the extent that people can really derive that wisdom, integrate it into their being, into their nervous system, invite it in, they really, really see the results.
That's amazing right there.
Yeah.
You said 83,000?
83,000.
You said 85% of those people are just doing it just on their own?
As far as we know. I mean, this is all an estimate. We ask people, are you in therapy? And then, about 40 to 50% in our intake do say, I am in therapy. But of the ones who said they were in therapy, only about 30% had brought it in to their session. So we're estimating about 15%, maybe 10 to 20% have already brought it into their sessions. I can personally tell you, I have brought it into my sessions. My gosh, the insights you get, sometimes you're just floored by self-love, by self-understanding, by a real feeling of transformation.
That's one of the questions I actually had written down right here was like, what kind of results are actual therapists that have like integrated into their therapy sessions have? I know you have some on your site, but do you have any other like examples of how they have, had good results from including this in their sessions and whatnot now?
Yeah, I can speak to my own personal experience because
Okay.
we like that, right? So I've struggled with a phobia my whole life, and that phobia is of vomit. And using ketamine, I was able to come to a place of kind of working through some of the beliefs I had around vomit means danger. Vomit means, and a lot of this is intergenerational. I had some illness trauma in my ancestry line. Children dying of dysentery, children dying of cholera, things like that in my immediate grandparent lines. And I was able to come to a place of finding the part of me that already knows vomit in itself is not a problem. It just means the body's cleaning itself out. It's a function of the body to keep itself healthy. It's okay. It's just a cleansing. It's just a cleansing mechanism. And so I have 2 little daughters at home, and the degree to which I can now be present with them when they're sick is just so much higher. And what a gift that's been to be able to mother them in the way that I want to, rather than get panicked and have to run out of the room. So that's one example I can give. I can talk to about other patients anonymously if you'd like, but
I know that's fine. I feel like that's good right there. Just because you can take it into your real life experience right there, like you just said, even with your daughters in that situation, to have that phobia of vomit or whatnot going on, and having 2 daughters. Yeah, the kids will. That's something you're going to have to battle right there. You don't want to have to shut down in that situation right there. But also, I was kind of looking on the site as well earlier. So I know I mentioned general anxiety disorder, but I also have depression as well. So I have pretty much your site is me. I'm just like, oh, they sound like me too. So how does it help with people that are dealing with depression? I know it said treatment-resistant depression. Is that specifically what it's for, or just depression in general?
The scientific world is still kind of trying to figure out why it is that it works so well, and there are a lot of theories about it, and I'm not sure that we've really landed on the one true mechanism. It's like a complex system. There's probably a lot happening. One is it does seem to just soothe the nervous system in a way. I mean, we forget how somatic depression is. somatic. I mean, depression just feels like your body's like, something is wrong. I need to lie down in bed. I'm heavy. I'm aching. So to some extent, it is just a somatic feeling of, I feel relieved. Higher dose ketamine has been studied very extensively for suicidality, and people who are extremely suicidal and nothing else works, one infusion of ketamine will keep them away from any suicidal thoughts for upwards to 2 weeks. And this is like in cases where nothing else works. So there's something about ketamine being a neuroplastic agent. It does grow all sorts of new dendrites and connections in neural pathways as well. And that's the part where it is still somewhat speculative. Why is it that it's growing positive new connections and not negative new connections? Unclear. With the higher dose stuff, I do think that there is a way in which the ego is the source of most of our issues. And by ego, I don't mean like, being full of yourself. I just mean like the narrative voice in your head that tells you what is wrong, what is right, what's wrong with you most of the time. Right? So when we have a loosening of the ego, with higher doses ketamine, you could have an ego death, an obliteration of the ego. And that tends to be like very therapeutic for people. Just the experience of, oh yeah, that construct can be deconstructed. That is not like the end all be all, but that's the high dose stuff. So that's not necessarily what Joyous is offering. With Joyous, we're offering a loosening of the ego, the ability to kind of see through all of these negative beliefs that color everything in life when you are feeling depressed. And when you have a little bit of, you're taking the glasses off, they're still there. You're in the big room, you can kind of like see the glasses, and you can see that through those glasses, like there is that world that tends to get you down so much, but there's an alternative around it. And you can start to build connections between your sense of identity, your sense of self, and this other possibility, which is a truer possibility, right? Like our true nature is kind of like self from IFS, internal family systems. It is compassionate. It is calm. It is curious. It is at ease. It is wise. And ketamine can really help you connect to that state and make it a lived reality that you then learn how to return to even without the medicine.
So that's really good right there too, because when you mentioned ego death, and that's typically what I hear when people are taking like psychedelics. There's because people ask me sometimes, like when I'm battling my own personality disorder, it's just like, have you ever tried mushrooms or the MDMA or what's the I cannot think of what it is. I cannot think of what it is. It'll come to me in a little bit.
Mushroom, LSD, iboga, ayahuasca. I don't know.
Ayahuasca. That's what it is. That's what it is. That's what it is. They like, have you tried ayahuasca? Every time I see a video or something like, it's people like crawling on the ground, throwing up, crying. I was just like, I don't want to do that, and not realize I did it. It's just like, I think you said that's the difference between a psychoanalytic and a psychedelic, is
exactly.
That you don't have that necessarily out of body experience with ketamine as opposed to like
go low, go slow. It's so much gentler. It's gradual. It's skill building, but I think it gets a lot of people to the same place.
Mm-hmm. Yeah, because people tell me that I see the videos, people throwing up in buckets like this is ayahuasca. They're in the woods throwing up in buckets and crawling. I was like, they don't look appealing to me. Yeah, that doesn't look appealing to me. I like the people sitting on the couch saying, I feel better right now. I like that image as opposed to the woods and crawling around.
Yeah.
So I was also looking. Your site is very well put together. Like I said, it's a bunch. If you check out joyous.team, that's the correct site, right? Because I'm going through it and it tells how ketamine is made. And I had no idea. Like it's like the parasitic worms. I was like, wait, what? How did we get there?
No parasitic worms. But there is
it's
like
a molecule
fungal,
or something like that.
Yeah. There's a naturally occurring fungus that can derive the same.
Yeah, that's what it was. I was just like, that's very interesting, even how it's made and how people even figure out you can use this type of stuff to make you feel better. It's just like, I'm just fascinated by how you get to that point right there, and of how it gets right there. But you also mentioned the neuroplasticity of how it can rebuild synapses and pretty much like heal the brain. Can you talk more on that right there?
Yeah, absolutely. So, I mean, it's interesting. I was saying a minute ago, we don't know why it is that this tends to go in a positive direction, but it doesn't necessarily go in a positive direction, right? Like you could take a bunch of ketamine, have a horrible experience, watch some horror films, get beat up, and maybe that would, get instilled into your brain instead. So it does matter what we do when we're on the ketamine. We always ask patients to set an intention, be with their experience. If you're just kind of, you're popping it in and you're going to clean your house, and that's probably fine. That's like neutral to positive is fine. But to the extent that you can sit down, set an intention, use it as your meditation period, even better. But yeah, so the neuroplasticity is very real. It is one of the more neuroplastic agents that we know. There are studies looking at the little dendrites, which is like your neurons make connections to other neurons through dendrites. And there's a huge amount of dendritogenesis, which means dendrites are being born after ketamine. So the active period for the psychoactive effects is about 40 to 60 minutes, kind of depends on the individual. But for like 3 hours later, you might feel some sort of like an afterglow of just feeling calm, at ease, relaxed. And that's also a highly neuroplastic period. But some studies suggest even up to 2 to 3 days after, you are more porous. So taking in positive content, building positive habits, working through the stuff that is weighing you down in a skillful way, either with a therapist or if you're, your own skilled practitioner of meditation, of certain self-compassion practices. Very, very effective. Whatever it is that you choose to do in that window after taking the medicine can really reap benefits for a long time.
So I try to meditate, right? Because I'm big into trying to meditate and stuff like that, but my mind wanders so much. So I do what I call free thinking. I'll have these moments where I just sit down and just like try to let my mind flow. Would that be an optimal time to take I don't try to hold any thoughts back. I just kind of like let them loose to see where they go.
I have a couple of friends who've been on our protocol for about 2 years, one year and 2 years. They don't take it daily, but when they do take it, they turn on their voice recorder and they do kind of like what you're thinking. They're with their thoughts. They're letting them wash over them, letting the insights come. And when something comes that feels significant, they speak it out loud, and then they feed it into ChatGPT, or they use Claude with the Anthropic model. And kind of afterwards, they talk in Claude over time, tracks what it is that they're deriving and is able to connect back and is like, hey, you talked about how you feel in your relationship with your friend today. It reminds me of the way that you felt in your relationship with your mother the other day. Let's derive the insights that are mutual to, there's a dog barking outside my office.
Okay.
Let's derive the common theme here and like outline to you how it is that you've grown over time. So yeah, I do think that letting your mind wander with the ketamine is a good way to get some insights rolling. And if you can record them to any extent so that, again, they don't get stuck in that state-dependent memory, that you get those insights, that you integrate them into your inner wisdom, you can really stand to benefit from something like that.
I really love that you added that part about talking out loud, because one of my main reasons for doing the free thinking is just to have these ideas, let them flow, to get ideas to do like content, and just let just a general release. And I don't want to open my eyes and stuff like that. I'm like, well, if it's important, I'll remember it later. And I feel
sometimes I do, sometimes I don't. Yeah. Right.
Yeah, sometimes, yeah, absolutely. I really don't remember it. I'm like, gosh, I should have just wrote that down. So the talking out loud part is very interesting. I might actually have to add that to my repertoire now.
And I don't know if you have an iPhone. I don't know Samsung or Android as well. Great. Well, if you have an iPhone, if you do the voice recorder, they now give you a transcript.
Oh, I didn't know that.
Yeah, now you get a transcript, and you're like, all right, ChatGPT, tell me what my greatest insights were. And it's
interesting. That helps out a lot, because I promise I like, that's a good idea. I should open my eyes and write it down. Like, no, but then I break my state, and then I come at the end. I was like, I had something. I had some fire, and I just put it out. Yeah, it's frustrating. I'm glad you added that part. I wrote that down for later. I'm like, okay, I'm gonna save that tidbit, because that's gonna help out
awesome.
Later on.
Cool.
But I also wrote down this question earlier, like, who wouldn't you recommend this to? Like, who wouldn't be a good fit for this?
I just recorded a module on that yesterday for the therapist training that we're doing. So one, we will screen out the contraindications that are red flags on medical and psychiatric fronts, and that's stuff like uncontrolled high blood pressure, no good. If you've had like a history of cerebral hemorrhages, probably not a good fit. There's certain like liver and kidney disorders that we then, ask for medical approval of, stuff like that. But we'll take care of that. Psychiatric side, past history of psychosis, unfortunately, probably not a good idea. Mania, like bipolar 1, we don't take bipolar 1 at this time. There's some mixed evidence in the literature on ketamine and bipolar 1. Some studies have actually found that it's really beneficial, but that's such like a high acuity need that it's probably better to work directly with a psychiatrist to test it out, like have much closer observation of the patient than we can do over telehealth. But we do work with bipolar 2. We don't currently work with borderline personality disorder. Again, I think there's not enough research on how that might work, but we don't want to destabilize people who might be going into like severely dissociated states. So again, we're going to cede that to working in person with a psychiatrist. Those are the major psychiatric and medical red flags. It might be also a question of timing, is something I talked about in the module I recorded yesterday, which is like, okay, like, are you stable right now? Do you have a support system, even a few friends that you could call if something comes up for you that's like, oh, wow, that really hurts. I felt this blanket of safety on the ketamine state, and I reached into some really deep traumas, but now they're up. Now I'm thinking about them. Do I have support system? Am I in a stable housing situation? Those are some considerations there. And then there's some timing too. Like if you really did just now lose your job, get divorced, death of a loved one, maybe stabilize first and then, go work with the medicine later. Those are some things I might think about in terms of both like red flags and yellow flags, and maybe just timing considerations as well.
Okay, I understand that. That's really good because you had mentioned that so when you are getting a client or a patient or whatnot, you would require their medical history or to integrate that into that as well?
We do a medical intake, which is like a 15 to 20 minute long form that you fill out your medical history. We do medication checks on our electronic health records, make sure that there are no contraindication medications as well. We don't request past history, but it behooves you certainly to tell us the truth if you have a psychotic disorder. We have not come upon that as a problem at this point. So it's not like we request medical records, but we do ask for medical records, and then the clinician, the prescribing clinician that works with us also does telehealth visits with you, makes sure that all the I's are dotted, all the T's are crossed, and like there are no major contraindications there. This is a good fit for treatment, and then you have follow-ups with that clinician as well.
Okay, that sounds good. It sounds in depth, like what's needed, because some people could I feel like some people could come in there and lie, just like I'm perfectly fine, I'm perfectly healthy, no BPD, just to have their fingers crossed behind their back or whatever the case may be. So what about someone with ADHD? I feel like that's such a common thing that's thrown around. Like I have ADHD.
Yeah.
How would this work with someone with that?
My friend Sarah is an ADHD coach who uses our protocol. She has personally found it extremely helpful. I don't think it's ever been studied systematically, so I can't say for a fact. One thing that I do find, I also have ADHD. Okay. My brain is a little squirrely. When I take 2.5 milligrams of Adderall these days. We do ask patients who are on stimulant medication like Adderall, like Ritalin, like Concerta, to take it 4 hours apart. Ideally, first the stimulant and then the ketamine. So if you take, you wake up at 7 a.m., take your Vyvanse, and then by 11, you could potentially take your ketamine for that day. Just because they both do raise heart rate a little bit, so you don't want that coming together necessarily. I don't have like a cognitive mechanism explanation of how it might be helpful for ADHD. Sarah might. She might be a fascinating person for you to talk about. She's thought about this pretty deeply, and she does sort of think that since it quiets the mind in general, that squirrel mind, might just have like a little bit of a quieter pool to wait around in. But this is my sort of very dumbed down understanding of how it might be working there. I don't think there's been any real research on this. One really cool thing about Joyous is since we have the largest data set of any psychedelic or psychoactive substance ever, it would be kind of interesting to have researchers come in and take a look at some of our findings. We built an anonymized, HIPAA-compliant, safe data querying system for researchers to be able to come in externally and work with that. I would love to take a look at what we're finding with ADHD patients. And there are other potential possibilities there. Like I had a clinician come to me as part of the Joyous Therapist program who works with autism. And she was like, I have found this medicine to be extremely helpful for certain facets of autism spectrum. She herself is autistic as well. And so she's creating some programs for us to take a look at how this stuff works. But right now, the research is just not there to say mechanistically what's going on. But many people have been finding benefits for different conditions. And I think a lot of it is the neuroplasticity, a lot of it is the nervous system relaxation, and a lot of it is the ability to be in that spacious, quiet state and just be able to observe your experience with much more ease.
Thanks for sharing that, because I feel like that when you said the quiet state, that made a lot of sense with a lot of people who might be battling ADHD or just autism in general as well. You know, autism is a spectrum disorder. It's far-reaching and whatnot. Because I literally that's one of the next question I was going to ask about the autism and whatnot, because that's, I guess it's more in the media now than ever, and whatnot, of how this could benefit or what kind of effect would it have on someone that is, possibly dealing with autism spectrum disorder or something along those lines. And whatnot, like you just said, was it you or you said somebody that you, a colleague?
The woman I was referencing is a woman in the Joyous Therapist program. She herself a psychotherapist and is also autistic.
Okay.
With some guidances that she thinks are really appropriate for people with autism.
That's good. So where do you see like the ketamine treatment therapy going? What do you see this in the next few years? Because I feel like it's spreading. I know you said right now it's just based in the States. Well, not based in the States. It's just the States is where it's located at right now. What do you see this at in the near future?
We would love to be able to treat internationally as well. We don't have the team size at this point to support that, but hopefully we will grow and be able to do that. A couple of things that I would love to have happen on Joyous. I want content creators to create exercises, to create guidances that they think are well matched to the psycholytic state. And perhaps we can approve them, make sure that they're clinically sound, and make them available as well. I would also love researchers to come in and be able to work with our huge data set and try to derive some, real insights about how does this medicine work, who is it good for, how do we optimize the treatment. And I'm building more and more sort of on the digital therapeutics front to educate the patients. What are the most helpful self-conceptualization, other conceptualizations, world conceptualizations, and practices that can help really align yourself with your best self, with your true nature. So those are things I would love.
Yeah, I can see it going far, because what we talked about so far, it touches so many different modalities of therapy just in general, and so many different mental health issues and whatnot as well. And I think that's because, like I said, I was trying to do my own research before you hopped on here, but you've opened my mind up. And I was telling my wife earlier, I got to talk about ketamine and stuff, and she was like,
"What?
I've been interested in it as well. Let me know how it goes." And I was like, "Yeah." I was excited when I saw it. I was like, "That's interesting," because I want to I feel like that can help out, because I'm trying to push the mental health, thing past just narcissism, because that's what I've been talking about for the last 5 years, and it's kind of make my head hurt. So I'm just opening it up to helping more people that are battling their own kind of, I guess the operative word, mental health demons or whatever, right? To open it up to lower the shame, to lower the anxiety and things like that, because I feel like that in and of itself could help out so many people, because even the stigma or the shame that's attached to even going to therapy in and of itself, I feel like this could help out with that too, because so many people
We're
have
all
just
in
such,
pain. Yeah,
yeah.
let's destigmatize pain because we are all in pain.
I feel like you
It
should
is hard
like
being human. Yeah,
crop dust. I feel like we should crop dust the United States with the with a low dose, just for a month. So we all just calm down a little bit.
everyone just, yeah.
Yeah, so I could just chill a little bit and whatnot. So do you have anything else you want to share? Any closing thoughts? Any final thoughts about what do you want to do? Like anything you feel like is pertinent.
Yeah, I hope that everyone who feels maybe called to break through the plateaus they're on, who want to experience like a shift in perspective, who want to maybe experience more self-love when the egoic narrative quiets down a little bit and you're in that spacious place and you're able to see yourself with these new eyes. It can be just such a healing experience. Anyone who's interested, come check out the program. And any therapists who think that they might want to incorporate this into their toolbox, it is a really potent approach. The training required is much lesser than for psychedelic assisted therapy because the psychiatric and medical emergency risk is almost negligible. And we really want to hold your hand as you explore this as a Joyous for Therapists partner. It is a free program. Reach out to me personally. I'm at therapy@joyous.team. Happy to discuss and really looking forward to connecting with anyone who feels moved to explore this option.
Yep. Thank you so much. I'm actually going to mention to my therapist my next therapy appointment and whatnot. See what she thinks and whatnot. I'm open to trying anything. I'm just
Absolutely.
about growth and openness and trying to reach more people and just trying to get more people help because I feel like we are in a mental health. Just it's just so tough out there for mental health right now. Just everybody's suffering in some way, shape, or form, and I feel like if everybody can't get the therapy, I feel like do something. Doing something to help you is better than doing nothing at all because you're only just going to destroy yourself. But I'm going to put all your links here, and I'm so thankful you decided to come on here and share. I've learned a lot. I'm pretty sure everybody else is going to learn a lot. This won't be the last time you hear from me, I promise.
Awesome.
I'm going to put it everywhere. Thank you again, Dr. Sharon Niv, for joining us, and we will chat later.
Thank you, Lee, for everything you do. It's really a beautiful podcast. Thank you.
Thank you so much. Okay.